This is Eyewitness News, now at 4.
A non-invasive screening test for prostate cancer that saved a local man's life. I'm Denise Tudor. Straight ahead in my Circle of Health report, what men need to know, coming up on Eyewitness News.
The American Cancer Society estimates that more than 29,000 men will die from metastatic prostate cancer in the U.S. this year. A Long Beach man wants more people to know how a non-invasive screening saved his life. Is this something all men should look into? Denise Tudor has more in the Circle of Health report.
This non-invasive MRI study revealed a 5-millimeter cancerous lesion on 55-year-old Paul Colaccio's prostate. Without this test, Paul says he would not have known.
I had a PSA test and it didn't show cancer.
But Paul noticed he was going to the bathroom much more frequently, so doctors encouraged him to get an MRI screening.
So the only way mine was visible was through MRI. So MRI actually saved my life.
The challenge with PSA screening is that there were false negatives and false positives. A lot of men with an elevated PSA don't get cancer, and some men with a low PSA do. So now with prostate imaging, we can evaluate the gland prior to a biopsy.
If PSA screening isn't so reliable, should men still get them? Dr. Robert Princenthal, the director of prostate imaging at RadNet, believes these blood tests are an important part of men's health.
We feel that every man from 50 on should get a baseline PSA.
Back in 2008, when a government panel recommended that men stop getting annual PSA screenings, Dr. Princenthal says 1/3 less biopsies were performed. The result of that, more men presenting with late-stage disease.
Men need to have the shared decision conversation with their doctors about PSA screening.
And Dr. Princenthal believes patients like Paul who have symptoms and a family history should get prostate MRI imaging.
And the analogy is a woman would not get a needle biopsy for breast before a mammogram. Men should ask for the same.
A genetic test also confirmed Paul had a predisposition to prostate cancer. So now, 3 weeks after choosing surgical removal, he has peace of mind.
So important to just know your body and understand that if something doesn't feel right, to act on it.
In Tarzana, Denise Tudor, ABC7 Eyewitness News.